Hi, I'm Mike Brennan, orthopedic surgeon at a Level 1 Trauma Institute, just discussing today external fixation of a tibial shaft fracture that may be utilized in a damage control setting. So this is just an example of one way to do this, and I want to demonstrate a typical damage control orthopedic frame today for you as well. Not a lot of uniplanar external fixators are placed along the tibia. However, when in need, they can be very helpful. They can be utilized in a temporary fashion. They can be utilized to help maintain alignment for coming back to nail the fracture as well. And so safe points for the tibia, obviously proximally we have the entire anteromedial. We can go directly medial with the pins in themselves along the entire surface anteromedially, as well is going to be fairly safe. If we're coming down distal, we want to be careful with our anterior pins as the neurovascular structures are going to start to cross in this anterior aspect. And so we have to be cognizant of that plane there. But we can place a direct medial pin down along the physeal scar, as well as up proximally. That would avoid any of the nail potential if we're going to use a nail in the future. You can also consider whether or not this is going to be a short-term frame or a long-term frame. Short-term frames maybe have less pins. We may just use a self-drilling, self-tapping construct, whereas if we're going to use a long-term frame, we may consider pre-drilling the holes themselves for the half pins, as well as more pins for longevity. And so it can be a simple frame of just 2 pins on each side of the fracture. It could be multiple and 3 on 3 of either side of the fracture. And so I'll demonstrate a fairly typical straightforward frame here. Here we have 5mm pins, which I typically utilize in the tibia. Lengthwise would depend on the patient's soft tissue envelope. Fortunately, not much on the medial side, despite, or potentially their calf would be the only limiting factor up proximally. And so here we have a nice quick connect, which makes the life a lot easier. There's no chucking involved or anything to that degree. We could use a soft tissue sleeve protector as well. And again, up here, we can be anywhere around this area. Directly medial is really nice, and you can consider a direct medial pin in the plane just almost as a polar blocking screw for a future nail. So that's also something to consider once you get used to the nail design and the Herzog curve of that. And so here we'll go just a typical frame for this. You can go anteromedial to posterolateral. Here, quick connect, really nice and easy. And again, I typically will start my frames from the pins that go farthest away from each other, and then provisionally fixate that and work around those pins. And I try to keep them as collinear as I can and not off axis from each other to allow for ease of the bar construct, especially in a uniplanar design such as this. It can be critical for that. And so here I'm anticipating the physeal scar to be at this level. Clearly I want to watch out for also the saphenous vein and nerve that are going to be coming in this region as well, so directly medial can be very beneficial to that as well. Again, I'd like to be bicortical if possible, down low. However, you have to make sure that you're not getting within the distal incisura of the distal tib fib region in that joint. So again, these are 5mm pins, which are easily seen. We have 4, 5, and 6mm options. Here we have 11mm by 300 bar, and we have 5, 8, and 11. Typically, I prefer to use an 11 just for the rigidity of that standpoint. So again, we want to be as close to the fracture of the bone as possible at this point, and then we can add stability by adding more pins if the fracture is mid-shaft, and then adding another construct as well. And so we can provisionally tighten these with the knobs here. Makes it really convenient. And the other thing when you're dealing with the tibia is I can make this a different construct and come off axis from one another to make this a more rigid construct as well. What I mean by that is if these 2 pins that you're seeing right now are in this plane here, we can set off different planes to make this a more rigid construct. And so I could come above it and be behind this bar to give just a little bit more rigidity. Again, if the fracture is mid-shaft, I want to be close to it as possible to increase that rigidity if necessary. Okay, but this is a fairly straightforward frame that we can easily bolster. And so we increase the length between these two for rigidity. Very simple, straightforward frame in a damage control setting. And again, I can utilize that in and of itself. I can then go back in and add another pin to this same construct as well. So let me back up and then do this again so you can see that from that standpoint. So again, very similar technique that I'll use is go ahead and place this pin to bar clamp on the bars that we have already existing. And what this does is allow you to simplify lining this up. And so again, we have this entire aspect that we can utilize. We can offset this. You can place these pins in backwards and indent the skin to see exactly where that needs to be. So here we'll be drilling in this area here. And you simply indent the skin or mark it with a marking pin. We know it's going to be roughly right here as we just saw. And going bicortical with this. Flip the pin around. It can really be this quick and simple as that, instead of trying to struggle to find exactly where these pins are supposed to be to where they're not too far off from one another. Again, same technique, same example. Gives you roughly the idea where you would be drilling this. Quick connect again makes it really efficient in the operating room in these circumstances when you're in a somewhat stressful environment and somebody who's in a damage control setting. And so here you can see it's really that simple, that fast to put on a frame. Again, I can go back and bolster this frame and this. I can use couplers as well. I could have placed these back here also to make sure that this was still in a single uniplanar correction, and then added bars to all four of these for an even more rigid construct. So fairly straightforward tibia. If you bring in this back to nail, that's very simple. If it's a straightforward shaft, you take these out. You can utilize this and this as a distracting tool or alignment tool to maintain your length as you're placing the nail down. So it's a very nice option. It's out of your way from x-ray, and you don't have a lot of hands maintaining that fracture stabilization. Your pin in your frame is already doing that for you.